Below is a fully expanded, in-depth medical-style monograph of Trazodone, Desyrel. This version includes maximum clinical detail while still remaining appropriate for educational purposes, not a substitute for a clinician's advice. Trazodone Desyrel, detailed drug monograph. 1. Generic name, drug class, brand name, drug forms. Generic name, trazodone hydrochloride. Drug class, SARI. Serotonin antagonist and reuptake inhibitor. Antidepressant, anxiolytic and hypnotic sedative properties. Pharmacologic actions, serotonergic, adrenergic blockade, mild antihistamine. Brand names, Desyrel, commonly used. Electro, extended release, discontinued in some regions. Other international brands, Tritico, Malipaxin, etc. Dosage forms, immediate release IR tablets, 50 mg, 100 mg, 150 mg, 300 mg. Extended release ER tablets, 150 mg, 300 mg. Scored tablets, some 150 mg and 300 mg designed to be divided into thirds. Oral solution, rare, not common in many countries. Definition. Trazodone is an antidepressant medication used primarily to treat major depressive disorder, MDD. It is also widely used off-label as a sleep aid due to its strong sedative effects at low doses. It works by altering serotonin levels in the brain and blocking certain serotonin receptors. Number 3, mechanism of action, detailed. Trazodone has a dual mechanism. A. Serotonin modulation. 1. Inhibits serotonin reuptake. Weak SSRI effect. Increases serotonin in synaptic cleft. 5-HT2A and 5-HT2C receptor antagonism. Reduces anxiety. Improves sleep quality. Decreases agitation. Lowers sexual dysfunction risk compared to SSRIs. B. Additional receptor effects. Alpha-1 adrenergic blockade, sedation, orthostatic hypotension, dizziness. H1 histamine receptor antagonism, mild, contributes to sedation. Minimal anticholinergic effects, safer than tricyclics for elderly or cardiac patients. Summary impact. Antidepressant effect, higher doses, sedation and sleep induction, lower doses. Anxiolytic effect, low sexual side effect burden. Number 4. Pharmacokinetics, detailed. Absorption. Rapid gastrointestinal absorption. Food increases bioavailability and reduces nausea. ER tablets designed for slow release. Distribution. Protein binding 90 to 95% crosses blood-brain barrier. Metabolism. Hepatic metabolism via CYP3A4. Major active metabolite, M-chlorophenylpiperazine, MCPP. Has serotonergic activity, linked to headaches, agitation in some patients. Half-life, IR 6 to 8 hours. ER, biphasic plus 6 to 12 hours, longer in elderly or hepatic impairment. Excretion, renal, metabolites, fecal minor. Number 5, uses. Clinical applications. FDA approved. 1. Major depressive disorder, MDD. Effective for moderate severe depression, often used when sedation is beneficial. Common off-label uses. 2. Insomnia. Most frequent off-label use. Low doses, highly sedating. 3. Anxiety disorders. 4. PTSD-related nightmares or sleep disturbance. 5. Adjunct for chronic pain or fibromyalgia. 6. Alcohol dependence. Reduces cravings, helps sleep. 7. Aggression or agitation in dementia. Caution required. Number 6. Indications. Detailed. Major depressive episodes. Depressive symptoms associated with anxiety. Sleep disorders, off-label. Patients requiring antidepressant therapy but cannot tolerate SSRIs, SNRIs. Depression with insomnia. Depression with sexual side effects from other antidepressants. Number 7. Contraindications. Absolute contraindications. Known hypersensitivity to trazodone. Concomitant use with MAO inhibitors. Must wait 14 days between switching. Use with IV methylene blue or linezolid, risk of severe serotonin syndrome. Recent myocardial infarction, acute recovery phase. Use with caution. Severe liver or kidney impairment. Cardiac conditions, QT prolongation, arrhythmias, conduction abnormalities, hypotension or syncope history, bipolar disorder, may trigger mania hypomania, suicidal ideation risk in young adults. Number 8. Before taking this medicine, precautions. Tell your provider if you have heart issues, long QT, arrhythmias, ischemic heart disease, liver or kidney problems, narrow angle glaucoma, seizure disorders, pregnancy or breastfeeding, bipolar disorder, history of suicidal thoughts, alcohol or drug use. Important precautions. Avoid combining with alcohol. May cause significant drowsiness. Risk of priapism, rare but serious. Risk of serotonin syndrome with other serotonergic drugs. Increased fall risk in elderly due to hypotension. Black box warning. Antidepressants increase risk of suicidal thinking behavior in children, adolescents, and young adults. Number 9. How to use administration. Take exactly as prescribed, usually at bedtime due to strong sedation. Take with food to improve absorption. IR tablets may be split in some doses. ER tablets must not be crushed or chewed. General tips. Rise slowly from sitting lying to avoid fainting. Avoid driving or machinery until effects are known. Do not abruptly stop the medication without guidance. Number 10. Dosing information, detailed, educational only. Doses must be individualized by a clinician. A. Depression, adults. Initial 50 to 100 milligrams orally, 2 to 3 times per day. Increase every few days as needed. Usual effective dose, 150 to 300 milligrams per day. Maximum, outpatients 400 milligrams day, inpatients 600 milligram day. B. Sleep disorders, off-label, 25 to 100 milligrams at bedtime. Doses above 100 milligrams often cause next-day sedation. C. Elderly, start low, 25 to 50 milligrams per day. Increase slowly due to hypotension and fall risk. D. Hepatic renal impairment, may require dose reductions, clinical judgment. Number 11. Missed dose and overdose. Missed dose, take when remembered, skip if near next dose. Overdose symptoms, extreme drowsiness, respiratory depression, severe hypotension, QT prolongation, arrhythmias, seizures, serotonin syndrome, coma. Seek emergency medical care immediately. Number 12. Stop or avoid taking, discontinuation advice. Stop and seek urgent help if you experience suicidal thoughts, allergic reaction, painful erection lasting 4 hours, priapism, severe dizziness or fainting, heart palpitations or arrhythmia, serotonin syndrome symptoms, severe vomiting, agitation, tremor, fever. Do not stop abruptly. Possible withdrawal symptoms, anxiety, agitation, insomnia, nausea, flu-like symptoms. Number 13, side effects, comprehensive list, common, 10%, drowsiness, sedation, dizziness, dry mouth, blurred vision, headache, constipation, nausea, fatigue, orthostatic hypotension, unsteady gait, fall risk. Less common, edema, confusion, tremor, sweating, sexual dysfunction, lower than SSRIs. Serious, seek immediate care, priapism, serotonin syndrome, QT prolongation, ventricular arrhythmias, hyponatremia, SIADH, seizures, suicidal ideation, severe orthostatic hypotension, syncope. Number 14, vital information, critical warnings, very sedating, avoid alcohol, opioids, benzodiazepines, high risk of orthostatic hypotension, stand slowly, may prolong QT interval, caution in cardiac conditions. Elderly are at high risk of falls. Avoid driving until drug effects are known. Requires monitoring in patients with heart conditions, electrolyte abnormalities, polypharmacy involving CNS depressants. Number 15, other drugs that will affect Trazodone. A. CYP3A4 inhibitors increase Trazodone level. Ketoconazole, itraconazole, ritonavir, indinavir, clarithromycin, erythromycin, verapamil, diltiazem, grapefruit products. B. CYP3A4 inducers, decrease Trazodone effectiveness, carbamazepine, phenytoin, rifampin, St. John's wort. C. Serotonergic drugs, risk of serotonin syndrome, SSRIs, SNRIs, MAIs, tramadol, dextromethorphan, linezolid, triptans, lithium, MDMA, ecstasy. D. CNS depressants, additive sedation, alcohol, opioids, benzodiazepines, sleep medications, zolpidem, esopiclone. EQT prolonging drugs, antipsychotics, haloperidol, ziprasidone, methadone, fluoroquinolones, macrolide antibiotic. Thank you. Have a nice day.